Provision of prenatal support as well as timely management and treatment can make the difference between life and death for mothers as well as their babies.
You recognize that some mothers don't turn up until the baby is literally ready to be delivered.
Government intends to change that with a maternal and a newborn health initiative called Start Right.
Start Right brings before us a tremendous opportunity to improve our maternal health offerings, but even in a broader sense, the family. Ensuring a mother's well-being before, during, and after pregnancy will enable her for better care for herself and her newborn.
The program forms part of government's effort to reduce the maternal mortality ratio to 70 per 100,000 live births by the year 2030. Jamaica's maternal mortality rate at 2018 ranges 93.5 per 100,000 live births.
We have some targets that we focus on. In Jamaica, we are trying to reduce our maternal mortality ratio to 70 per 100,000 live births by the year 2030. We're some ways from that. I am told, are 110 per 100,000. In 2016, we had gone down to 93.5 per 100,000 in 2018, and the preliminary data in 2019, 2020, those terrible COVID years suggest that it has inched back up. I don't have the specific number. But that's something that we have to keep working towards.
With Start Right, vulnerable mothers and their babies will now have greater access to diagnostic services across the public health system. The initiative is a partnership involving the Ministry of Health and Wellness, the American Friends of Jamaica, AFJ, and the Jamaicans Abroad Helping Jamaicans at Home, JAJA Foundation. Included in the supplies are handheld ultrasound machines or butterfly monitors. The portable devices, supported by iPad technology, will enable early and rapid diagnosis, such as screening for birth or heart defects, prenatal testing, and checks for pregnancy complications.
So we're focusing on pregnancy with the donation of and the provision of training on the use of these portable ultrasound machines, and after pregnancy with the donation of needed supplies to aid in the care of both mother and child, which is very important.
This device is truly a game changer. For example, instead of bringing patients to another department to have an ultrasound being done, this device is 100% portable and can be placed in the doctor's pocket, as I just demonstrated. And you can see here, truly streamlining patient care.
We hope that we will actually move on to phase 2. Our goal is to have these handheld devices in as many doctors' pockets as possible.
In the initial phase, 100 adolescents and other vulnerable mothers will receive snuggle nests, a portable infant lounger bed, as well as essential items including diapers and skincare, oral care, and hygiene products.
This snuggle nest will also be critical. The intention is to use it starting with vulnerable mothers as a pilot, and hopefully incentivize them to come to the clinic for prenatal care, and then hopefully allow the health system, doctors and nurses, to better understand their particular circumstances and give the babies and mothers the best possible outcome.
The benefiting facilities are spread across the island and include Victoria Jubilee, Kingston Public, Cornwall Regional, Black River, Savannah Lamar, St. Anne's Bay, Maypen, Princess Margaret, Mandeville Regional and Spanish Town Hospitals, and the University Hospital of the West Indies. And by March, plans are in place to expand the program to aid 2,000 expectant mothers. The Start Right program, giving vulnerable mothers and their babies a head start at life.